you are.
That's right. Yeah, I'm glad you're here. Is everybody settled in? Does everybody know their microphone buttons and all that stuff? This is kind of a new thing for us. I would like to remind all the commissioners, when you want to say something, be sure to unmute yourself and then state your name. All right. Good afternoon, everyone. I would like to call the November 16th, 2021 Senior Citizen Commission meeting to order at 2:05 p.m. Manager Goodsell, you have an announcement for us?
I do. I want to let the commission know that Alan resigned yesterday from the senior commission. And the reason being is he is working full-time now at USD as a teacher. And so it conflicts with the meeting schedule here. But he did want to let you all know how appreciative he was of serving on the commission and getting to know all of you and working to serve seniors as an advocate. And spend several years on the Senior Citizen Commission. So we really appreciate all of his efforts, his time, his dedication, and volunteer hours serving over the years. And we do have a certificate that we will be mailing to him in appreciation for his service. So with that being said, there is an unscheduled vacancy that we're recruiting for with the term ending March 2023, and the deadline to apply is Thursday, December 2nd. At 5 p.m., and that can be done online. So if you know of anyone, please spread the word. Thank you, Chair Lambert.
Thank you. Clerk Gilliam, would you do roll call, please?
Yes, when I call your name, if you say present. Commissioner Ling?
Present.
Commissioner Angel?
Present.
Commissioner Hanwitt?
Present.
Commissioner Farley?
Present.
Commissioner Kramer-Levander?
Present.
Commissioner Rao?
Present.
Let all the records show all commissioners are present.
Commissioner Angel, would you like to lead us in the Pledge of Allegiance?
I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right, thank you. I understand we have a couple of special presentations today. I'd like to start with Joe Gavin, who is the Chief Programs and Community Engagement Officer for San Diego Seniors Community Foundation. Joe, it's good to see you again.
Test. Hello? There we are. It didn't hold? Did it hold? Oh, there you go. Okay, great. Thanks, everyone. Thanks, Christy and Tracy, for inviting me back to give a presentation about the work of our foundation. For those of you who weren't here last month, my name is Joe Gavin. I'm the Chief Program and Community Engagement Officer for the San Diego Seniors Community Foundation. We are a unique foundation. As far as we know, we are the only community foundation in the country that really has a specific mission, which is to provide support, services, building an infrastructure, and building a philanthropic pipeline for all things related to older adult issues here in San Diego County. My background in the Aging Services Network, previously I was about 8 years with an organization called Serving Seniors. I worked a variety of roles of direct service practice, from supportive housing to running a senior center in downtown San Diego, which is the Gary and Mary West Wellness Center, which is a comprehensive wellness center that addresses issues such as homelessness. I ran a transitional housing program, education services, the whole gamut of services for older adults of pretty limited income, with some with complex behavioral and physical issues. So about 2 years ago, I decided to move on to something more macro level, and I was fortunate enough to come in touch with this foundation, which was started by Bob Kelly, the former CEO of the San Diego Foundation. And Bob, in his 20 years in leading that organization, saw peripherally like the issues that were coming to a head for older adults and what the services are going to be needed going forward. So I just want to talk about why a community foundation and why right now. And last month I mentioned that I could summarize it in one word, and that is precedent, as in there isn't any. We are facing a historical demographic shift. Never before in modern society will we be facing the issues of an aging population to the degree that we will be over the next 10, 20, 30 years. And aside from the demographic sheer numbers, which here in San Diego County, the statistic we like to cite is that between 2000 and 2030, a span of 30 years, we'll see a growth from about, I think it was 400 and some thousand to a total of almost 930,000 people at the age of 60 or over. So of course, over 30 years, we'll be adding almost 525,000 people to over the age of 60 here in San Diego. To give you some context, that's equivalent to the size of the city of Atlanta, Georgia. So we think of that level of size of population coming in, and going into a time of life where things change a little bit, where needs may be more prominent, is that has the infrastructure grown along with that population? And in our view, it has not, which is one of our motivating factors to try to do something right now to address these issues going forward. Aside from just sheer numbers, there's really what we like to call a hostile ecosystem for many older adults. There's the issues of just some really ominous financial variables on the horizon. More and more people having to rely on Social Security as a lone source of income. And because we all know about inflation and the cost of housing and the cost of medical care and the cost of food and really the cost of really anything are going up. And with people on fixed incomes, as we go forward, even though there was a COLA increase of 5% for Social Security recipients, those costs get immediately those debt raise gets immediately eaten up with inflation, as well as, I don't know if you saw, the Medicare Part B premium went up 15%. So whenever money is provided, additional funds are provided for Social Security recipients, there's almost always an immediate recapture of that through those economic variables. Aside from that, people coming from smaller nuclear families, traditionally lots of support services for older adults have been provided by family members or a friends network. Well, a big family now is 2 or 3 people, and we're much more geographically dispersed. So I use my mom as an example. She still has 5 adult children living in the Chicago area where we were raised that can provide to help her with her activities of daily living and supports. Well, having that level of amount of kids is something of a bygone era. Like I said, now 2 people are a big family, and we're much more geographically dispersed. So mom and dad might be here in San Diego, but the kids might be in Kansas City or Milwaukee. And so we look at the situation of what will take the place of that in-kind family network, and some of that cost, some of those responsibilities will fall upon societal structures. And that's what, just a real quick, as far as our goals are, we look at a senior center as an existing model that has potential to address at least some of these needs in lieu of other services, in lieu of market rate services that are beyond the means of many people. If you want to get caregiving services, it's depending on what level of service you need, it's $25 an hour, $30 an hour. That's just for basic routine services. That's out of the price point for many older adults, and that will only be growing again as with the spike in costs for housing here in San Diego and the cost of living, just providing a much more way of challenges for people on a fixed income. Excuse me. So again, we see the existing common talking points regarding how we're going to serve older adults. We talk about you read in the newspaper the solvency of Social Security, the solvency of Medicare, but again, there's other variables in place that exert pressures upon the way society, counties, municipalities come together to provide supportive services for people in need. The current aging network, as I said, I don't believe, in my experience here in 10 years in San Diego, has grown commensurate with the level of population. And another factor that we had to incorporate into this is that people are living longer. In previous generations, people would work, retire around 65, spend a few years with the grandkids and maybe enjoying retirement, but then pass away. But now with modern technology, medications, improvement in any number of medical services, if you make your 65th birthday, statistically speaking, if you're a female, you live to be about 87, for a male, about 85. So you hit that magic milestone of 65, there's still almost a third of your life ahead of you to be lived. And again, we think of what can we provide to people to provide support so they can maintain living in their communities they love and in their homes they have lived in, is to maintain a sense of independence and health and providing services in a way that, rather than the traditional model of utilizing institutional care, is to keep services based in the community so people can live longer and participate in the communities they've grown to love. And I think right now is a real opportune time. Obviously, coming out of COVID, the challenges that older adults have faced have been laid significantly bare. We all know the physical implications that COVID presented to people, but there's also some long-standing issues we're not quite sure what's going to happen. And that was probably the impact of the lack of socialization, of the public health policies for people to isolate in place. There's going to be a long-term consequence for that. So as we come to the tail end of this pandemic, hopefully there's some really positive frameworks being developed at both the state, the county, and also the municipal levels in trying to devise these things called age-friendly plans or visionary frameworks to bring about a new conceptualization of what aging services can be in the community. I'm not sure if all of you are familiar with the California Master Plan on Aging that was released in January of this year. It's a 10-year blueprint that outlines how California communities can, again, imagine or reimagine or create new modalities to provide supportive services for the community. And we are aligning our efforts with that. I view these frameworks as, it's great to have this vision, it's great to have this idea, this blueprint, but it's also incumbent upon people who work in the services industries to have tangible options in order to make those visions a reality. So one thing that we look at in our efforts is that we are producing a Senior Center Master Vision Plan that will be it'll be for publication in February or March of early next year, that will kind of lay out an outline of what we envision, how senior centers can be transformed, what they become, how can they be responsive to all these emerging challenges. But it's fantastic that we have momentum at both the state, county, as well as also municipal levels to provide some funding certainty behind some of their proposals, which is a positive, and also to have this kind of a document we can hold these policymakers to account. It's just not going onto a shelf and, oh, we'll revisit in 10 years. It's an actual living document with a dashboard that has specific goals. So we, as a foundation, are really looking at this document as a really important transitional period to, again, to use it as a guideline to provide tangible ideas of what we can do to, extend services for older adults here in San Diego. Briefly, the work of our foundation is, again, we are unique in the sense that we are driven by not only philanthropy or building the philanthropic pipeline, because the statistic that we like to comment on I think, is about 3% of all institutional philanthropy. Only 3% is given to older adult issues, and we are endeavoring to change that with our efforts to engage various stakeholders, private and public foundations, again, upon looking at how we can devise strategies and utilize existing resources and infrastructure to build along to address these emerging needs. We also have we are creating a public policy and government relations committee to really bring together various stakeholders in the network. Because one of the things, since the pandemic has waned a bit, we've gone out to various senior centers and spoken with different nonprofits about various needs and how things are going. And certainly it was a struggle for many senior centers during the pandemic. But a common refrain that came from all our visits, it was pretty common amongst all the directors, was that there wasn't much a way of a voice for them. And we, as a community foundation, we can be that voice. We can be that kind of unifying agent, that catalyst to kind of strengthen a network in order to bring issues, again, to a forefront and to have a home. And because, we have people speaking and independently, there isn't much to really carry that voice. But if you speak with a unifying message, with a group, with a coalition, with a consensus, we are working strongly on developing that type of effort here in San Diego. So we see it as a gap. There are some prominent older adult advocates who exist in the community, but there's not many, certainly not that many for the size of a county of San Diego. And like I mentioned, we have a couple of projects coming up. We're releasing our senior master vision plan for senior centers in probably February and March, and we'll certainly release that to all interested stakeholders, local officials, senior centers, and the aging network, again, to kind of give a framework of how we can reimagine and create new momentum for senior centers to be more responsive to community needs. We have a senior center coalition meeting that we lead bi-monthly. We have about 30 or 35 stakeholders, primarily from senior centers, but also from some nonprofits, where we get together and talk about issues that are facing senior centers, talking about some best practices, some ideas, and again, to recognize the limited resources available in the network, how we can leverage existing resources to improve things. I'll give you a quick example. There's this great organization called the Challenge Center in La Mesa, which provides physical therapy for adults, for people of all ages, really, after insurance won't pay anymore. So they hit like a certain level of functionality, the insurance stops paying for it, but you have people who are stroke victims, who have ongoing disabilities, who really can benefit from more intensive physical therapy. And this is what this organization does. So anyway, we had them come on the coalition meeting last month, and they have an innovative program where they'll take to senior centers and do fall assessment risk, and eventually, hopefully, roll out this innovative program that basically teaches people how to fall. I know it sounds counterintuitive, but it's really it's an evidence-based program that they found in, I think it was in the Netherlands or somewhere in Central Europe, that teaches people if falls are going to be inevitable, how can I fall safely? So that's and then from that outreach, I think 7 or 8 centers reached out to this Challenge Center to provide this program. And that's what I'm talking about. It's like developing this network. We've seen a gap that senior centers just don't have a voice, don't have a place in which to share ideas and concepts and get other resources. That's why we lead this coalition meeting, is to establish that and to strengthen it and broaden it as we go along here. And I'm excited too. I mean, as we just took a photo for, we have a holiday grant program. We realized the impact of social isolation last year during the pandemic was much more of a strict lockdown. So we were able to provide funding for 13 unique events that took into account the needs for social distancing, but still had a holiday festive event to provide really a nice event for older people who had been shuttered inside and not really having any source of socialization. So this year we felt it was still important to have this, so we brought it back this year, and I'm happy to report that We provided funding for 26 organizations, so 26 senior centers, including Encinitas, as well as some other nonprofits. We'll be having these special events ranging from drive-through holiday parties, delivery of gift bags to homebound seniors. One location, Fallbrook's, having a holiday film for Hispanic older adults in their remodeled theater in downtown Fallbrook to engage those older adults, but also give out gift bags. So really, it's all about, again, engaging people and trying to bring them back. We recognize how the isolation that has caused significant issues for older adults. So it's really excited to talk about that, as well as a more long-standing, more long-view effort to provide. It's called Empower San Diego Senior Centers, which is a grant program we'll be releasing in February of next year to provide the more day-to-day support efforts. Things that we've recognized being an issue is a couple of centers actually don't have any paid staff whatsoever. So we want to do a program where we can maybe provide funding for an executive director to come on board to make a more of a professional standard to a center. We have an issue with many centers not having actual CRMs or data systems to really capture important data on what their programs are doing. Is there efficacy? What do seniors want? Who's coming? What's the demographics? And then the reason that's so important, not only to track what you're doing, to seeing what has impact, but also for fundraising issues and running for grants. It's important to have that data to demonstrate the efficacy of what your efforts are. So we're looking at the executive director issue, the CRM issue, also facility upgrades. I mean, like I said last month, if I could wave a magic wand and put 15 Encinitas community and senior centers throughout the county, I'd be happy. It's a wonderful location with a dedicated senior space, but also the general community can come in that fantastic gymnasium. I think that's just a wonderful model, and it's a really attractive place, warm, welcoming. So, kudos to the staff for a great, for really having an inviting center. But that's kind of what we want to produce, countywide. Because there are some places that don't have that effect. You walk in, and it will, if I ask you to think of what a senior center is, some of you may have just it's a place where people go to play bingo, or it's this and that, and that's kind of a common perception amongst a lot of people. And we want to diffuse that and change that concept by having modern-looking facilities that are bright and welcoming and really inviting. And I said, there's several places throughout the country that don't have that. So a mission of ours is a long-term idea of transforming these centers to becoming modern facilities with amenities and more expansive programming. Things you might not attribute for older adults, like having employment programs, because one of the financial issues going forward is that more older people are going to have to work. More of them want to work, but some will have to work because they have no choice, because again of the financial situation that is going on. So our efforts are kind of long-reaching. We're trying to build a brand, build our purpose, because I think we fill some gaps. Again, there's an aging network that does remarkable work, but they're focused on, rightfully so, their own responsibilities within their organizations. We feel that as a catalyst, as a convener, as a partner, we can advance the mission of everyone by speaking collectively and getting people together and broadening the concepts of what healthy aging is, as well as when we think of healthcare, and all the money goes into healthcare, but the very little that goes into preventive things, like things that happen at a senior center, the nutrition programs, the education, the exercise, all things that impact physical health, the volunteer programs, all the things that make life worth living, the quality of life. And I guess down the road, if we have a goal or a vision we want to hit, is somehow that this community health aspect that we're kind of championing can find some funding of some sort, either through managed care organizations or the healthcare system, to provide money for preventive measures and of doing things to the community that keep people healthy. Rather than looking for the next new medication, let's invest in nutrition services, physical fitness, exercise, socialization, education, all these things, again, that make for a quality of life. So I'll just wrap up by saying that, again, to reiterate the changing demographic we face. In 2015, there were 28 million more kids under the age of 18 than people over the age of 65. By someday in 2032, 2033, we will see a historical occurrence. There'll be more people over 65 than under 18 in the U.S. The policy and consequences of that level of demographic shift is, we can anticipate some things. We just don't know what the long-term, consequences of that are. So that's why we as a foundation here in 2021 are recognizing not only the needs right now, but what lays ahead, so that both today's and tomorrow's seniors have an infrastructure to realize what's called the longevity dividend, that we all live a good life and enable towards a later chapter of our life to still participate, still engage, and still find meaning and purpose in our communities. So with that, I wrap things up, and I thank you for your time. And if there's any questions, I'd be happy to field.
Thank you, Joe. I think what he means is we have our work cut out for us. Commissioners, do you have any questions for Joe?
Yes, Laura.
Do you provide any services to educate seniors about the risk of elder abuse, elder financial abuse, things like that?
We are not a direct provider of services, but we will convene one of our Senior Center Coalition. I think last year we had Scott Perillo, who's the local DA, who's in charge of prosecuting the elder crimes. So he came on and gave a wonderful presentation for all the directors to talk about things, what can you do as far as, the scams are out there and what you can do to protect seniors. And various organizations will provide any number of seminars and about that topic. So there's quite a few existing resources for that issue. But again, we like to facilitate and make as many connections as we can. So having I go to the Elder Council meeting, which is a quarterly meeting that convenes law enforcement, the DA's office, the FBI, other entities, again, to start addressing an issue that, again, unfortunately only going to grow in intensity, and that is both financial as well as just elder abuse in general. Yes.
Yes, well, first of all, I'd like to thank you very much. I'm so encouraged by your presentation today and the future of our senior demographics. And it certainly, your enthusiasm, your passion has been conveyed. And I'm very supportive of everything you've presented. And I just really appreciate the fact that you are so dedicated to your mission. Thank you.
Thank you. I appreciate that. Thank you, Mona. Just real quickly, if I could leave you with something, are any of you familiar with the World Health Organization AARP effort for age-friendly cities? I don't know if this has been something you've talked about as a commission. I know there's examples. For example, Chula Vista, La Mesa has produced a age-friendly plan. I think National City and Carlsbad are in the process. The county has. So I'm not sure if you're familiar with that, but there is a 5-year plan to maybe make Encinitas, again, for this meta vision of an age-friendly community, which can take any different number of forms depending on what your community shape is like. But I'd be happy to send you the links to all these different plans if you would like. I can send them to Christy. Maybe she can forward them to the commission.
That would be great. Thanks, Joe.
Okay, I'll do that.
So, Joe, I have a question for you. What are some of the challenges that we face in North County right now in terms of supporting these senior services and activities?
I'm sure there aren't a lot of agencies, several social service agencies. I mean, there's Interfaith. I'm not sure if JFS comes up here, if they have a footprint in this area.
We do.
But I think there's probably, we talk about stigma and perceptions about senior centers. There's probably a stigma kind of like with North County, thinking, well, they don't need services up there. Yet I'm sure that, you have locations that certainly do. And I think we get, and that's something we do as our foundation, is we're equity-minded, but we recognize there are people in need in every community. So I think you might have a situation with that. As far as I'll kind of ask you a question in the same vein. As far as the community involvement, are they really behind issues like this, or is this something that you find a challenge with the community? Just not say apathy, but just have other priorities. Because with social services, you think that it's people. Usually, it's people who don't have the means for market-based solutions. If I have money, I can buy my caregiving, I can buy, assisted living, I can live in fancy, assisted living entities. But, social services, it's generally for people who don't have the means to do that. So I guess, what's the community temperature, so to speak, and is there, really a push for providing, supportive services for older adults or for other populations here in Encinitas?
Yeah, I think it was something you had said before with regards to awareness and outreach, in that the senior centers really serve a very small percentage of the eligible population.
Right. I think, our 2019 assessment, we estimate like about 8 to 10% of a community targeted population will, involve themselves in services. But that's a question, it's like, what comes first? Is it, is the fact that they're not coming because they don't know about it? Is it because they know about it but don't really care about what services are offered? So it's interesting, that's why I think it's important to develop like focus groups. And then, it's something we'll be doing as we build out our senior center master vision plan, is try to engage in various focus groups throughout the county to get a better understanding on that. Again, and people often, centers will lament, well, we don't get younger seniors here. But, do you understand the dynamics of why they aren't coming? Many of them are maybe still be working, they're caregiving, they might be raising grandkids, they said they're still working, they might have other volunteer opportunities. So do we understand, is it the product themselves, or is it just the societal variables that just don't allow them the time to participate in such, such places? Yes.
I was wondering, on your 10-year blueprint vision, where are you at on that? How's...
Well, the 10-year, that's actually the state of California's 10-year, the master plan on aging is a 10-year blueprint that this state issued in January of this year. And unlike like most blueprints, I have some optimism behind this, because they have a data dashboard that's kind of holding things to account. And they have, I think, 120 goals they want to accomplish within a 3-year initial period of the plan. And again, one of the positives of it is that there is some policy behind it. There is some budget certainty, at least for the next couple of years. We'll see what happens when these federal funds kind of dry up, to make, to see if things can stay sustainable at the state level. But nevertheless, at this time, it's really, I'm encouraged by the structure of it and the initial part of it. So, and when I send the plans to you all, there will be like information about all the different goals. There's 5 primary goals, and underneath that, there are objectives to hit during that initial period. But there is some lofty vision. The first goal is affordable housing for all. We all know here in California that is a significant challenge, and just something that won't just happen overnight. But it's good to have lofty goals. I guess you want to dream big, but we want to also, again, hold, if they're professing this in an official government document, it's up to stakeholders like us and other individuals to hold them accountable to what, this vision they lay out, and to keep the conversation going, and to make sure that this is something just not going to get kicked to the side when, after initial like momentum of the first part of the release. So, yeah, but our blueprint will be coming out in probably February or March about the senior center ideas that we have. Great.
All right, thank you, Joe, for coming back and presenting to the
Yeah,
entire
absolutely.
commission.
I enjoy it. So please, if I can be of assistance with anything, Christy can share my email. I'd be happy to answer any questions. If you have more questions about, again, that age-friendly plan, some of the links out that I will send, I'm happy to talk about it. And so I hope it's a great holiday event here. We're glad to participate and help out the Encinitas Community and Senior Center. So thank you all for your time, and have a wonderful Thanksgiving.
Thanks again. All right, our next presenter also happens to be on our commission. This is Jessie Hanwood, and she is the director of the North County San Diego Neighborhood Food Project.
Let's see, I hope this is still on. Good. Okay, so thank you for giving me the opportunity to talk about the North County San Diego Food Project. It's probably one of my favorite things to talk about. And when Christy asked me to come and give an update, I started thinking about it, and I thought, well, Commissioner Rao and Commissioner Angel have been a part of the project since it began. And Christy and Lambert have heard a little bit, drips and drabs about it, since it first got started about a year ago. But we have two new people that probably I don't know whether we've been mentioning it. So I figured the best thing to do is just take a few minutes and just give you a little bit of an update on how this even happened, and then I can tell you where we are now and what it looks like we're going to be doing in the future. So this food project actually began in Oregon probably about 12 or 13 years ago, and there were a couple of people that lived in Ashland that just had this idea that the food banks weren't getting food on a regular basis. You know, people were giving around holiday time, and then the year would go by, and they were needing to get more food supplies. So they came up with this really simple idea that they could enlist neighborhood coordinators, and the neighborhood coordinators would go to their neighbors and sign them up as food donors, and then once every 2 months, the neighborhood coordinator would go around and pick up the bags that the food donors were given. They were this color. Ours look a little bit different. They'd put them out near their front door, and the neighborhood coordinator would pick them up and take them to the food bank. And they would leave an empty bag with them with information about when the next pickup was. And so I signed up as a neighborhood coordinator. I was living in Medford, Oregon. And I did it for about 2 or 3 years, and I just felt like it was such a wonderful project. It was the greatest feeling to come out in the morning and see the green bags going up the street. And then I moved to California about 8 years ago, and eventually, about 3 years ago, found myself living in High Country Villas, which is over 55 community in Encinitas. And we have about 520 people live homes there, the majority of which are over 55. We have a little section that's all age. And when COVID came upon us, I started thinking that the food project would be a great thing to try to start in High Country Villas. We were all feeling very isolated, and you didn't want to go out, and you didn't want to talk to anybody, and you're just kind of stuck in your house. But we all live very close to each other because it's all attached. So I started putting little feelers out and asking people and going to the HOA meetings and seeing what the climate was. And everybody seemed pretty enthusiastic about it. So the next thing was to figure out a way to fund it, because there's not a lot of funding, but you do have to purchase bags, and we have some little cards that have to be printed. And luckily, my son owns a business in Encinitas, and he has graphic designers that work for him, and he was very generous and said that he would be happy to get it started. So I met with some people that had volunteered as, we call them block coordinators, because we have people that have a block that they're assigned to rather than a neighborhood. And they said they wanted the food to stay in Encinitas, and so I contacted the Community Resource Center. And they were thrilled with the idea of getting food from us every couple of months. So we also have a website, and we're going to have to get a new picture for it, because eventually we're not going to have to show people with masks, I hope. But you can see Mona and me. And Mona helped with the website. The parent organization, the Food Project organization that started in Oregon, still exists, and they're very nice with giving technical assistance. And the project is now in 11 states. So everybody's doing it the same way, and it seems to be working well for everybody. So we, at High Country Villas, we have 18 block coordinators, and Mona has covered where she lives in Cardiff. And the idea is that the block coordinator will go out. They get like initially a door hanger, and we thought of this for COVID so that this could be hung on the door. You could ring the bell, step back. It has information about the project for the person to read, and the information about the pickup. And the CRC has specific items they like picked up every 2 months. And then when the pickup happens, the block coordinators pick up the bags and leave an empty bag with a little thank you card that has that information on it, and they take them to our clubhouse, and we have volunteers that have bigger vehicles, and they drive them out to the CRC warehouse. So we started our first pickup last March, and we've been averaging about 180 bags of food each pickup. And I did a little math because I thought, gosh, I'd love to know what that means exactly. So if we're averaging 180 bags per pickup, and each bag probably averages about 8 pounds. I mean, some of them are crazy heavy where you can hardly even pick them up. Some of them are a little lighter. There's no request for amount or anything. But that means that over these 5 times that we've had pickups, we've collected over 7,000 pounds of food, which I think is pretty exceptional. And the other really cool thing that's happened is that we had Katie Martinez here from the Girl Scouts a while ago talking to us about things that the Girl Scouts could do to help us, and we talk each time we meet about intergenerational programs. And I didn't ask for this, but the block coordinator that lives in the all-age area of High Country Villas called me after our pickup a couple of times ago, and asked if her daughter's Girl Scout troop could join us and get bags and be part of the project. And so we picked up last Wednesday, and they contributed 10 bags that it was self-care items that they had collected, and they want to continue to do it. And the other thing that happened is what I do is I meet with whatever block coordinators are available every few months just to get feedback from them and let everybody can share how things are going for them. And there were a few people that were saying that the writing that they have to do on the back of the cards, because they have a lot, I mean, some people have 15 or 20 donors, is a lot of writing. And, a couple of people had arthritis, and they were just saying, oh gosh, it's so much writing. But there were a couple of other people that had discovered using Avery labels, and they were printing out labels and putting them on there. And then I thought about what Katie had told us when she came to talk to us about how the Girl Scouts were earning badges in technology and in helping seniors. And so I reached out to her and eventually made my way to Lambert's wife, Kathy, who's a Girl Scout leader. And so starting for our next pickup, for those block coordinators that are interested, we're going to give them the information that they would need to print to print these labels and the cards, so they can get our cards all ready for us when we have our next pickup in March. In January. So I'm really excited about that, and I think that when we have our next get-together, we'll make sure that we do it at a time that the Girl Scouts could join us so we can meet them and they can meet us, which I think would be nice for all of us. And then the last thing that I wanted to share was about expansion, because right when it first started, it's an easy process, and I always felt like, well, just the way it did when I lived in Oregon, it just spread from city to city and neighborhood to neighborhood, that it could go far. There's no reason why it couldn't if you had the right people that were involved, that were interested in doing that. But the biggest problem is that you have to have a little bit of money to be able to get the bags and the cards. And so for the last 6 months or so, I've been searching to see if I can find a foundation or something. I write grants. So I thought, well, okay, I could write a grant. Somebody could be a financial sponsor for me, because I'm not a 501c3, and I don't know when I would want to do that. And I wasn't having any luck until about a month and a half ago, when I stumbled upon a guy named Jonathan Schwartz, who owns a company. It's not a nonprofit, it's profit-making, but he has a degree, a master's degree in gerontology, and he runs a company called Partner in Aging, and they're like a referral service. So, if you had a family member or a neighbor or somebody that needed to get into assisted living, you could call them, and they don't charge people for that, and then they get a commission. And I was telling him about the project, and I asked him if he might want to sponsor it, because I had this thought that since it worked so well at High Country Villas, and it seems to make people happy, they just feel good about being able to give, and people need the food that we're giving, that I might try to go to other over 55 communities and see if I can get it started there. And so lo and behold, he said, yeah, he would love to do that. So now I have a sponsor, and we're changing some of the materials so they're more generic. And all I have to do is go to these, is find other have a list of over 55 communities, but what I'm going to do to start with, when I first moved here, I lived at Lakeshore Gardens, which is a little over 55 place in Carlsbad, and I have contacts there. So tomorrow, actually, I'm going to go and speak to somebody there and find the right people, to start asking, if they would like to do something like this. Start small. So if you know anybody that lives in an over 55 community that you think might have some kind of enthusiasm for doing this, I would love to hear about it. But it's been a really heartwarming and exciting adventure for me, and it makes me really happy that everybody is so enthusiastic about it. I mean, there's nothing negative about it, honestly, except that sometimes people don't put their stuff out on time, and then we end up with bags and the trucks have gone. So our website has all the information about the project, and it allows people to sign up from the website, which hasn't happened yet, but I keep hoping that, maybe eventually somebody will stumble upon it and want to do that. If anybody has any questions.
Thank you, Jesse. Commissioners, any questions?
I don't have a question, but I can just tell you, as far as my personal interaction and involvement with this program since its inception, it's been extremely rewarding, and I have loved it. And just interacting with my neighbors and seeing my neighbors so happy to help. And it's just a very worthwhile community endeavor. So thank you so much, Jesse.
Thank you, Mona.
Laura Rao, Commissioner Rao. Jesse, I understand that at one point we had an idea of how many people were actually being fed. And was it hundreds a month? So the food was going directly to our community.
Yes,
Okay.
yes, right. And I did have that. I don't have that statistic in my head anymore, but I know how many, if you go on the CRC website, they list how many people they serve, because they have a pantry, and if you are down on Second, you can see people waiting to get in to get food from them. So all I know is that they are thrilled to get our donations every 2 months, and they're very specific about what they want us to collect, as you know, because they know where the needs are and what the people need that use their services. So everything gets, is put to very good use.
Jesse, you mentioned that now you've got the funding to go to expand the program. Are you still looking at servicing basically City of Encinitas, or are you expanding out to North County?
Well, I'm really thinking over 55 communities, and there aren't many in Encinitas, so I'm thinking North County, anywhere where, because I think it's such a good fit for over 55 communities, and I think it's a good direction to take, really. The majority of the people aren't working and have the time to, not that, I don't know, there's, in all the other places where it's happening, people are working and doing this. It's not really all that time consuming, but I think it's something that over 55 places can kind of hang on to and turn into a success. So yeah, North County.
Thank you, Jesse.
Mm-hmm.
All right, next item on the agenda. Do we have any speakers for the oral communications?
We have none.
Very good. Off to the next one. Do we have any changes to the agenda?
No changes to the agenda.
All right, next is the approval of the minutes. Do any of the commissioners have changes they want to make to the minutes? Do I have a motion to approve the minutes for September 21st, 2021?
Commissioner Angel, I'll make a motion to approve the minutes for September 2021.
Commissioner Angel makes the motion. Is there a second?
I'll second that, Commissioner
Commissioner Hanwitt seconds.
All right, we'll call roll, and when you hear your name, if you're in favor of approving the minutes, say aye. Commissioner Ling,
Aye.
Commissioner Angel,
Aye.
Commissioner Hanwitt,
Aye.
Commissioner Farley,
Aye.
Commissioner Kramer-Levander,
Aye.
Commissioner Rao.
Aye.
Let the record show the minutes pass unanimously.
Thank you. Next agenda item, action items. Let's look over the Senior Citizen Commission Annual Work Plan Review. So commissioners, please chime in if you have updates that you'd like to add to the work plan. First item is with regard to community outreach, attend city-sponsored events, serving as city ambassadors. Anyone?
This is Manager Goodsell.
Yes.
So I wanted to talk about the Encinitas Holiday Parade. And the good news is that it will take place this year on Saturday, December 4th on the North Coast Highway 101. And the parade is going to begin at 5:30 p.m. And the theme this year is Encinitas Rocks. And entries are encouraged to go all out with their creativity, showcasing great music across different genres and generations. And the city is asking that all parade participants and spectators wear face masks, so it's highly encouraged. And then the parade is preceded by a tree lighting ceremony at 5 p.m. with an appearance by Santa at the lumberyard. The commission does participate in the parade every year, and so I was hoping to get a confirmation from who is planning on attending, so that way I can identify how many convertibles we're going to need on the parade route. So
Commissioner Angel, and I've already contacted you, but I'll confirm again that I plan to attend.
Okay, great, thank you.
This is Commissioner Ling. I will plan on attending.
Wonderful.
This is Commissioner Hanwood. I'll plan on attending as well.
Okay, great.
This is Commissioner Rao. I'd be happy to attend as well.
Wonderful. Okay.
That's a lot of convertibles.
Well, hopefully we can get you into one convertible or maybe two. But I did want to let you know that I did contact the senior award winners, and we do have some of them participating as guests of the Senior Citizen Commission. And so we've got Greg Butler, Rhonda Krakow, and Ann Olmsted that'll be your guests this year. And Greg has volunteered his 1999 red Mustang convertible, and so he's going to drive the award winners. So we've got that covered. And then do any of you have a convertible that you're interested in driving, or do you know of anyone that has a convertible? No? Okay, I'll work on it.
Thank you.
Thank you.
Item 2, identify guest speakers for monthly meetings to provide education regarding topics related to seniors. I actually have one. I've been talking with Kathy Bird, who has been running the CRC Holiday Package Program, and I realize that they're hot and heavy right now getting things ready, but she's experiencing some challenges with senior outreach, specifically not so much to the institutional seniors, but the ones who are maybe aging in place or being taken care of by families. And she would like to talk to us, present a little bit about the program, and then ask us for some help. So I'll give you, Manager Goodsell, I'll give you the contact information.
Okay, great, thank you.
Anyone else? Item 3, direct marketing of safety-related messages to senior citizens. Any updates? Special projects. Item 4, continue partnership with the Encinitas Rotary Club and explore other Encinitas Service Club partnerships. Any updates?
This is Commissioner Angel. So I know that we work very closely each year with the Rotary Club, and previously I had reached out to the VFW, Veterans of Foreign Wars chapter here in Encinitas, and I had received a positive response regarding support of the Senior of the Year awards. And I would like to reach back out to the VFW here, as myself being a veteran, and find out whether or not they would continue being more active as far as participating in this annual program.
Thank you, Commissioner Angel. Item 5, enhance senior programs, including computer assistance, Feeling Fit Club, and baby boomer offerings such as Boomers Club. Any updates?
Commissioner Angel, again, the Feeling Fit Club, I'm not sure of where the what the status is. The last I heard, there was an understanding or an agreement that had been sent, and we're still waiting to find out. And I would like to follow up regarding this. This was my initial interest, and I brought this to this commission and to this city, and I'd like to follow this through, so I'm going to follow up.
Item 6, explore intergenerational programming in collaboration with the Encinitas Youth Commission. So I do have an update on this. We did finalize the survey a couple of months ago, and the survey went live about a month ago, I think. And we've gotten some feedback already. We're starting to collect data. One of the things I noticed today is we see a lot of responses from seniors, not as much from the youth. So we're going to see if we can do a little targeting. I've reached out to the Girl Scouts Service Unit, and we're hoping to connect back with the Youth Commission to see if they can do some things to get some good input from them. Okay, item 7, explore practices and policies of other jurisdictions in the county at the state level. Any updates? Item 8, research grant opportunities for Encinitas senior programs and submit proposals as needed. Any updates?
This is Manager Goodsell. So I have some wonderful news. I reached out to the County of San Diego for a status update on the grant that was submitted, which was the Community Enhancement Grant application that Commissioner Hanwitt worked on. And that was for the shade and fitness equipment. And the good news is that we are going to receive $20,000. At least that is the recommendation from the county. And so we're just waiting for the official email that will be sent this week to us. But we will be awarded funding for the project. So that's wonderful news. And thank you so much, Commissioner Hanwitt, for all your hard work on that grant. I really appreciate it. And then, of course, the other good news, which you heard earlier from Joe Gavin, our presenter, we did receive the funding for the Holiday Gift Basket Program, and that's another grant that Commissioner Hanwitt wrote on our behalf. And so we will receive $1,500 to put together some goodie baskets for the senior nutrition participants for the holidays, which will be fantastic. And I believe the Girl Scouts will help to assemble those baskets.
Yes.
So thank you all for your collaborative effort and hard work on that. I really appreciate it.
And thank you to Commissioner Hanwitt.
And thank you also to Commissioner Ling, because he gave quite a bit of feedback during the grant writing process.
All right, onward to agenda item 9, informational items. Manager Goodsell, do you have an update for us?
No update.
Item 10.
I'm sorry. I thought you were still on the work plan, item number 9. I apologize.
We wrapped up.
Let me go back to the agenda here. There we go. I do have an update for you. All right, so regarding the statistics, we served 394 meals at the Senior Nutrition Program in September and 442 in October. 88 rides were given in September and 91 in October to and from the nutrition program. And there were a total of 437 program participants in September and 538 senior participants in October. Regarding the recreation guide, the staff are diligently working on the winter recreation guide, which will cover January, February, and March. And it's anticipated that it will reach the Encinitas residents by mail on December 4th. The next item here is the New Year's Eve dance. So we're happy to announce that tickets went on sale yesterday for the New Year's Eve dance for $10 a piece. And we plan to have live music by the Rhythm Express Band, a light dinner provided by the Flavor Chef, and a toast with Martinelli's. The festivities are going to go from 2 to 4:30 p.m., and we are definitely looking for volunteers to help us out. So I don't know if any of you are willing and able and available that day to help us out, but we would like someone to help with serving the food, pouring the beverages, helping to clear the tables, put on wristbands for people that purchase tickets and greeting the guests, et cetera. The volunteer hours are from 11 to 5:30. You don't need to stay there the whole time. We'll have certain shifts available. So does anyone have any interest in helping out that day?
Manager Goodsell, this is Commissioner Angel, and I would be delighted to participate and support that.
Oh, thank you so much. I really appreciate it. I will be in touch with you.
Count me in.
Anyone else?
Yeah, I can do that as well as Commissioner
Great,
Hamel.
thank you. Thank you so much. Okay. All right, and then finally, the art night is going to take place on Saturday, December 11th, and that's from 6 to 9 p.m. There will be shuttle service available to take you to the galleries, and the participating sites, again, will be, of course, City Hall, the Encinitas Community and Senior Center, the library, and various art galleries in Encinitas. And that concludes my report. Do you have any questions?
Thank you, Manager Goodsell.
Thank you.
Item 10, Commissioner Member Initiated Agenda Items. Are there any? No. Item 11, Future Agenda Items added by commission members. Are there any items that the commissioners would like to add for future agenda items? All right, it's time for the item 12, Commission Reports Roundtable. Let's go down the row. Actually, it looks like Commissioner Hanwood has something to say.
Yeah, I have one webinar that I attended actually yesterday. It was put on by the Center for Healthcare Strategies, and it was called Getting Started with a Master Plan for Aging, Strategies to Build Buy-in Within States. And I guess I didn't realize what it was going to be when I tuned into it, but it talked about all the other states in the country that don't have a master plan. There are actually very few that have one that's already been passed, and California is one of them. There's probably about 4 that have them, and they were giving ideas about how to enlist people to get involved in that. But it was very interesting because they were talking a lot about the stakeholders and who would be involved and what kind of services they would need to have, and it's so all-encompassing that it'd be a wonderful thing if all of these, if every state had one and they actually got implemented. They all have wonderful goals, so it was very interesting.
Any other remarks? Okay. The November 16th, 2021 Senior Citizen Commission meeting is hereby adjourned at 3:05 p.m. Thank you, everyone.